Hello. If you're watching this video, you may have been diagnosed with human immunodeficiency virus, better known as HIV. In order to better understand your diagnosis of HIV, what it is, how you may have gotten it, and your plan of care, let's watch this nurse-patient scenario.
Hello.
Hi Adam, my name is Jenny.
Hi Jenny.
I'm going to be your nurse today.
Okay.
Your doctor has ordered this consultation for us to just go over your HIV diagnosis. It's very important for you to understand your disease and how to take care of yourself in order to better your prognosis. So let's just start out today with any questions you may have.
Well, I kind of, I have no idea really what this is, so I'm just wondering, what is HIV?
Well, HIV is short for human immunodeficiency virus, and it is a virus that your body cannot fight off like it would other viruses. When you contracted the virus, it entered your bloodstream and began attacking your T helper cells, which are cells that your body has to help protect you from illnesses. The T helper cells, which are also known as CD4 cells that you'll become familiar with your labs, they are responsible for sending out a signal to other cells of the body that kill infection. The HIV virus will go directly after these CD4 cells and take over, causing the CD4 cells to produce many copies of the virus and send it out to infect other CD4 cells. Infected cells are defective, and then they die early, causing a decrease in your body's number of CD4 cells. The reduction and infected CD4 cells make it hard to fight off infections, leaving an untreated HIV positive person likely to become ill.
Oh, well, that makes sense. How did I get HIV?
Well, HIV can be contracted from unsafe sex with someone that is infected or sharing hypodermic needles with someone that is infected. It can also be contracted to healthcare providers or other people that have come into contact with the blood of someone infected with HIV. Mothers can also transmit the virus through breast milk. If you have participated in risky behaviors such as unsafe sex or sharing needles, or have come into contact with the blood of someone that may have the virus, that is the likely cause. It is very important to try to contact others that have participated in these risky behaviors with you so that they can get tested and treated as well.
Can I give it to my loved ones?
It is possible to transmit it to your loved ones, but like I said earlier, the only way is if you were to share bodily fluids that carry the virus, such as blood, semen, vaginal or rectal secretions, or breast milk. It is a good idea that those that may have been in contact with any of your bodily fluids or are even worried about having contracted the virus from you should get tested.
What if a family member came in contact with some of my blood that dried up, like from a razor or something that I used to shave my face?
Good question. The HIV virus does not live long at all outside of the body, so it is extremely unlikely. But to be safe in the future, you should not share razors with other people or things like that.
HIV is transmitted through bodily secretions such as blood, semen, vaginal and rectal secretions, and breast milk. Those most at risk for contracting HIV have a history of unprotected sex, multiple sexual partners, IV drug use, and general drug use. Additionally, those who engage in any form of anal sex have a heightened risk of contracting HIV.
Are there any tests that my friends and family can have done to make sure that I not give them HIV?
Just like you had done, we will draw their blood and do a rapid HIV antibody test, but keep in mind that it can take 3 to 12 weeks for there to be enough antibodies in the bodily fluid to test positive. If the tests come back positive, it needs to be repeated. If the second one comes back positive, there will be a Western blot test or an immunofluorescent assay test done. Blood that shows positive in all of these steps will give a diagnosis of HIV positive.
Okay.
Diagnosis of HIV is made by testing HIV antibodies and or the antigens in the blood. There is a time period called the window period that is between the potential infection and the point of time where test results can be read accurately. This test can typically be read anywhere from 3 weeks to 3 months after the person has become infected. A highly sensitive enzyme immunoassay, or EIA, is done to detect the serum antibodies that bind the HIV antigens. If the test result is negative, but the patient reports risky behaviors, encourage them to do another test at 3 weeks, 6 weeks, or 3 months. If the test result is positive, perform another test for accuracy, and then a more specific test following that, such as the Western blot test. One type of rapid HIV testing is done by screening an oral fluid sample for antibodies, not antigens. The results of this test are received the same day and are highly accurate. This method is recommended by the CDC. Combined antigen antibody test is also used and allows for the diagnosis of HIV during the window period when the antibody may be undetectable but virus loads are high. Remember, antigens may still be undetectable for about 2 to 6 weeks after infection. I hope this has helped you better understand the testing methods involved in the diagnosis of HIV.
What other difficulties can I have now that I have HIV? Can it cause other health problems?
Yes, unfortunately, because HIV inhibits the immune system, common opportunistic infections can easily take over and cause you to become ill. Infections such as tuberculosis, pneumonia, cytomegalovirus that is caused from the herpes virus, toxoplasmosis, or cryptosporidiosis caused by parasites. Those can happen. Candidiasis or yeast infection, more commonly caused in your mouth or esophagus. Those become easier to get. More serious or progressive complications are Kaposi sarcoma and lymphomas, which are both cancers. Neurological complications and kidney diseases can happen as well. If HIV is not managed well, you can develop AIDS, which is a more progressive and serious form of HIV. So it's very important to stay compliant with your medications and follow up with your healthcare team.
AIDS is diagnosed when the patient meets certain criteria. As viral load increases in the patient, the absolute number and percentage of T cells decreases, and there is risk for developing opportunistic diseases. The criteria for AIDS, according to the CDC, is the development of at least one of the following criteria. 1. CD4 T cells drop to below 200 cells per microliter. 2. An opportunistic infection such as fungal candidiasis, a viral disease, a protozoal infection, or a bacterial infection occurs. 3. The occurrence of invasive cervical cancer, Kaposi sarcoma, Burkitt's lymphoma, immunoblastic lymphoma, or primary lymphoma of the brain occurs. The 4th diagnostic criteria of the CDC includes the occurrence wasting syndrome, which is defined as the loss of 10% or more of the ideal body mass. Lastly, the 5th criteria is the development of AIDS dementia complex, or ADC.
Are there any symptoms that my spouse could look for to indicate that they may have contracted HIV?
Yeah, initially flu-like symptoms such as fever, fatigue, muscle and joint pain, weakness, swollen lymph nodes, headache, nausea, diarrhea, rash, night sweats, and oral yeast infections can be seen.
When I go in for my follow-up appointment, what can I expect?
Well, first of all, your doctor's gonna want to go over your CD4 or T cell count and your viral load. The CD4 or T cells are markers of immune function. We want them to be in the normal range, which is between 800 and 1200. The viral load provides assessment of the disease progression. The lower the viral load, the less active the disease. Results are reported as real numbers or as undetectable. However, undetectable does not mean that the virus has been eliminated. It's just that it is undetectable based on what is seen in the blood sample being looked at.
Is there anywhere I can go or any way I can get help with things like transportation, medical costs, or stuff like that?
Yeah, in fact, I brought this paper in for you. There are multiple locations that can help you just here in Las Vegas. There's a few. Aid for AIDS of Nevada, or AFAN, is a nonprofit organization that provides support for adults and children affected by HIV and AIDS here in Southern Nevada. This could be a great resource for support for you. Other nonprofit organizations that can help with housing and counseling options for those with mental health issues, substance abuse, or HIV and AIDS related issues is Golden Rainbow, the Community Counseling Centers of Southern Nevada, and the Nevada AIDS Project. Here's the copy. I want you to take this home with you today so that you have all the information that you need to contact anybody you may need to.
In addition to helpful programs and nonprofits, you can also use self-care management strategies such as diet change, self-comfort, medications, complementary treatments or CAM therapy, and spiritual care. Many people find comfort in these extra measures, and they can be done individually.
Okay, I imagine there's going to be a lot of people that I'm going to be working with. What kind of people are going to be working with me?
Well, your care team consists of your primary care provider, an infectious disease specialist, hematologists, pharmacists, nurses, mental health care providers, nutritionists, or dietitians, case managers, social workers, and possibly even a spiritual counselor or provider if that will help you.
Another type of team involved in a patient's care may be the palliative care team or palliative care nurse. Palliative care is a specialized form of medical care that aims to improve the quality of life for you and your family while your disease processes. Palliative care is provided by a team of doctors, nurses, and other specialists that will aid in extra support for you. One of the important aspects of palliative care is that nurses will spend time with you and your family and help you to better understand your very complex diagnosis while being sensitive to your life expectancy. Nearly every hospital in town offers palliative care.
Okay. So I imagine there's going to be a lot of medications. What kind of medications will I be taking?
Usually there is antiretroviral therapy. It's prescribed. You're going to hear it called ART therapy. This involves 3 or 4 medications used in combination with other medications in order to reduce drug resistance and combat the virus.
Oh, okay, that doesn't sound as bad.
Yeah, there's a lot of information. We're always here to help if you need anything, if you have any questions. Okay.
Okay.
It was very nice to meet you today, Adam.
Thank you for all of your help.
The types of drugs used for HIV include fusion inhibitors, entry inhibitors, nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitors, integrase inhibitors, and anti-neoplastic medications. An example of a fusion inhibitor is enfuvirtide, an HIV-1 drug that is indicated for use in combination with other antiviral agents. An entry inhibitor is indicated for the treatment of adults infected with only CCR5 tropic HIV-1 and who have been resistant to multiple antiviral agents. Nucleoside reverse transcriptase inhibitors, such as zidovudine, interferes with the virus's ability to convert RNA to DNA. Non-nucleoside reverse transcriptase inhibitors inhibit viral replication in the cell. Protease inhibitors inhibit the enzyme needed for the virus to replicate. Integrase inhibitors inhibit the integrase viral enzyme for HIV. Anti-neoplastic medications enhance the immune response and reduce the production of cancer cells. Use the pamphlet included in your patient education packet to refer back to these drugs throughout your plan of care. Take note of the adverse reactions that may occur and when you should contact your provider. If you have any questions relating to your specifically prescribed medications, contact your nurse or your physician.
Thank you for watching this informative video about HIV and AIDS. Your care team understands how stressful this diagnosis can feel and are here to support you and your health.